So we will be back. Let's take this report from the HOH Technical University. Stay with us.
Following the announcement by President Akufo-Addo for final year students to return to school to complete their respective courses, management of the HOH Technical University put in place measures to ensure adherence to the COVID-19 safety protocols. Signages of no mask, no entry, and hand washing stations were situated at entrance of lecture halls, hostels, and offices. The security posts were also detailed with thermometer guns to frequently check the temperature of students and faculty. Lecturers were tasked to ensure students observe social distancing and wear face masks in the lecture halls. Isaac Meiri is the head of public affairs of the HOH Technical University.
With the new directives for students, final year students, to resume today, 15th Monday, management went ahead to once again fumigate the halls of residence and the academic facilities as well. We have designed a form where we collected data of all the students who are entering the halls of residence. We also had the thermometer guns there, and we took their temperatures and kept the records on each person's form. Should in case there is an issue, we can easily trace. The university has identified or allocated some isolation rooms. We have also published our emergency lines 24/7 that anybody can call the clinic staff and they will be there to respond. The clinic also has selected some rooms down for isolation. So we are quite prepared. We cannot be 100%, but I am sure with the measures management has put in place, our students are in safe hands.
The Vice Chancellor, Professor Ben Hunyenugan, who acknowledged receipt of personal protective equipment from the government, disclosed that the institution would soon commence producing sanitizers for use by the university community. He emphasized management's commitment to ensure compliance with the safety protocols.
Anybody who is found, whether you are a staff or student, not wearing the face mask, first of all, they will draw your attention that you have to. And when you are going to enter a classroom and you are a student and without the face mask on, you will be turned out. You see, these are self-regulated issues. And then also as a staff, if you don't wear your face mask, you cannot enter even your office. Your superiors will ensure that you don't come there. And of course, the registrar's office will issue warning letters, and it becomes a disciplinary issue because it's a law. The laws of Ghana now is saying that by executive instrument that everybody must wear it.
All right, now let's go back to Professor John Japon, who is the Vice Chancellor of the University of Health and Allied Sciences. Hopefully we get a better connection in terms of the sound. Good morning to you, sir, again. Thank you for joining us on the AM show.
Good morning, Mama V. How are you today?
Very well, thank you,
You didn't mention my name too. I'm Roland, please.
Hi, Roland. How do you do?
Saleh Ade, Prof. Nice having you.
All right, so Prof, it was day one yesterday, it's day two today. Tell us about your campus and how it went yesterday. How many students, for instance, came back to school?
Well, we have much fewer numbers compared to the older universities. We were expecting around between 800 and 900 students. I need to get the exact figures. But according to the various programs, what we did was for each of the deans to meet with the students and take them through the various protocols that were expected to be followed. We have a peculiar situation here where many of our students do not live on campus. Actually, almost all final year students, except for the medical students, have to live in rented apartments in HOH. So what we have done was that for the medical students who were occupying 4 students, where 4 students were in a room, we've now reduced it to 2 students per room because the other medical students are not around, so that they can have a lot more space for themselves. The exact numbers I will need to double check, but the impression I got was that most of the students we're back.
So they're mainly back to write a final exams, is that correct?
For us, it is slightly different. As you would have realized, for the bigger universities, they did most of their exams online, but their colleges of health sciences are now back to go through some other programs, including some practicals and some ward work that they have to do. Ours is the University of Health and Allied Sciences, so all our programs are health-based sciences. So what we're doing is that for those who do not have to do clinical work, what they are having is a brush up of their of the work that was done online for 2 weeks, and then we have another week of revision, and then they do their exams. But the clinical students require a little more time. They need to go back to the wards and do some basic rotations before they can do their exam. So it is slightly different, and we are tailoring it according to the needs of the various programs. But most of our students will be done with their brush-up lectures within 2 weeks, and then a week of revision, and then exams. So even though we're given 6 weeks and 4 weeks of exam, we may not use all of it for all the programs, but the medical students may have to stay in until about August when they finish.
Now, let me take you back a bit, and this question may not necessarily relate to only the University of Health and Allied Sciences, but you as broader managers of the universities, and I know you have a body that you do great consultation with. Back at the beginning, when all this was becoming new to you, what was the agreement in terms of how you intended to roll out and manage all this?
Well, I think what has happened was that we held various meetings as vice chancellors via Zoom to discuss how to take this whole process forward. I mean, as you would know, it is a new thing, and we are learning as we're doing. The whole issue of even doing online teaching was a challenge for some of us. I mean, the older universities who have the infrastructure had no problem whatsoever. I mean, very little problem. And within a very short while, they rolled everything up. And some of us needed to start from scratch. We had to build our LMS from scratch. So it took us a little bit of time, but we are almost there. And I think what is becoming very clear is that we need to re-engineer the whole phase of tertiary education and incorporate all these other issues about online learning. But we've had lots of consultations amongst ourselves as vice chancellors, and at least 3 or 4 meetings with the Minister of Education and Tertiary Education to discuss how to take all these issues forward. And then last week we met with the President to get assurances that the basic things that we needed would be provided to get us going. So a lot of consultations, but as we say, the proof of the pudding is in the eating. When you start rolling out the programs, then you meet some of the challenges, and we try to resolve them to the best of our ability. But it's been a learning curve, and we are taking it one day at a time.
Well, great time to learn, but from my observation, I was thinking maybe you, the managers, on one hand, and the structures of the university, you were not ready for this, or it just plainly is it that you don't have the facilities or the resources to roll this out, whether virtually or physically?
Well, nobody is ever ready for a pandemic. But when it hits, you need to do what it is that you can. As I said, we are at different levels of development as universities. The University of Ghana, which is the oldest university, is 70 years plus, and then follows the others. UHAS and UNER are probably the youngest, and we are about 8 years old. So infrastructure are different. We have we have a wide range of facilities. So when these issues come, you don't throw your hands in the air and say, sorry, we don't have a learning management system, so we cannot do it. You see what it is that can be done on the spur of the moment, and then try and mobilize resources to see how you can organize a crash program on this. So we've had to develop our LMS over a very short period of time, train our faculty, and everybody was just hands on deck. And I think I love my heart out to our ICT directorate and our faculty for the great resilience they've shown over this short period, because the easiest thing to have done was to say, sorry, we don't have the system, we cannot do it. But that is not how you manage a pandemic.
But Prof, let's look at the hurdles that you have to cross going forward, because you've started. And you did say that is when you begin that you also begin to realize some of the challenges. So what have you discovered?
I mean, one of the issues that came to the fore was the fact that, I mean, I guess we knew it, but we didn't know it was that glaring, that it's not every student who has access. You know, we did our ICT team looked at the data, and over a period of time after we had rolled out our programs, we realized that initially it was about 5% of our students who hadn't had access at all, and then later on it came down to about 2%. But even if it is 2%, even if it is 2 people or 3 people or 10 people, they all deserve the right to get access. So for me, I mean, we worked with the telcos that if they were able to access the programs through our URL, there will be no charge. But you must have access in the villages that some of us come from. Some of the students couldn't get network at all to log onto the system. That is why, for me, it is important that we give everybody a chance. So this 3-week period prior to exams is very, very important for those people who didn't have access. So that is on the interface issue. But the major challenge is infrastructure for many of us. And even the older universities who had the learning management system, they did not build their learning management system for 80,000 students to be accessing. So occasionally you get some of them crashing. So
Prof, when you say infrastructure with your facility, what do you mean? What specific things are we talking about?
Oh, if we are to restrict ourselves to the learning management system, I'm talking of the hardware to develop, I mean, all the servers that you require to give access to. We have about 5,000 students in all, giving them access through a server with unlimited bandwidth and all that. We just were not prepared for that. And as I was saying, even the bigger universities who had the servers and all that were not set up to take care of large numbers. They built their LMS for distance learning students, which are not as high as the total numbers that we are talking about. So it's one of the issues that we've tried to engage government on. They've made some promises, and some of the other agencies have promised to work with us. I'm very much aware that NITA and Electricity Company of Ghana are working with us to try and improve our infrastructure. But I mean, that is on a long-term basis. I mean, but we have to deal with the crisis now. So we are making it with what we have.
We've had this refrain transitioning from the international front about how we're now going to live the new normal going forward. How do you intend, one as vice chancellors and you as an individual managing this great university, to ensure that virtual learning becomes part and parcel of the learning system at the tertiary level?
Yeah, so I guess it's about the same thing that I've been talking about again. It means now the reality has hit us that you cannot depend only on face-to-face interactions. So we need to build our systems. The systems need to be developed. And we are talking to government to make resources available for us to be able to get this done properly. Government asked us as vice chancellors to put together some estimates of what it is that was required to get the systems going. And almost every university that I know of was asking for close to $1 million to have a proper functioning system. The Ministry of Education suggests that, well, maybe we could have a system that is developed for all of us to make use of, because if everybody is going to ask for $1 million, maybe government may not be able to provide it immediately. So can we have a system that is built for everybody to make use of? Those are the discussions that are ongoing now, and I hope that government will make do of what it has promised, because without that, then we will be going around in circles.
Back to the same point, back to Batan, like we always do as a third world country. Well, Mama, you have a question?
Yes, I was just thinking, so what we've been talking about, we've been concentrating on the final year students. Is there a master plan for the rest of the students?
Yeah, again, we have discussed this, and the position of the ministry is that this will be a learning experience for all of us. And depending on how things go, then the next group of students may be allowed to come onto campus. Because as you would know, I think I heard that KNUST has about 13,000 final year students, and only the health sciences students were coming, which is about 1,500 or thereabout, which presupposes that for each year group, there are about 13,000 students or thereabout. So these are huge numbers. To bring them all onto campus will be an issue. But the good thing for them, again, is that just as they've managed to finish their teaching and even exams with most of the final year students, they've done same for the other levels. So if we manage to take good care of our clinical students who need all this time to get things going, then probably what will happen will be to get the clinical students from the other year groups also to come and finish. And then we see how the pandemic pans out and make decisions as we go along, because yes, we can talk about online teaching and all that, but even assuming that we're able to get all these things going, we really need to re-engineer the whole space to get things going properly. Yeah.
Just finally for me, Prof, is there going to be a certain form of cuts in terms of fees, knowing that we didn't, as students, we didn't use your facilities entirely for the semester that you charged us for the fees that we paid already?
Yeah, it is academic user fees, they say.
That is a very interesting question, and I've had a few people ask those questions, and legitimately so. But the truth of the matter is that the universities in this country are completely underfunded. We are struggling to keep the universities running. Government basically pays our salaries. And the various budget lines hardly come. And when I say government, I mean government. I'm not referring to MPP
as in the states. As in the states.
Yes, that is the state of affairs, and it's been so for a very long time. So these fees were introduced as academic facility user fees. If I tell you how much money we've had to spend to get a temporary online system going, you have no clue. So for us, a reduction of fees is not even on the tables because we are running at a loss. Education, tertiary education for that matter, is very expensive, and somebody must pay for it. And I agree that there are many students who may not have the wherewithal to be able to pay all these fees. But as happens in many parts of the world, brilliant students and people who are eligible to go to tertiary education should not be denied because they cannot pay. So we need to put in place systems. And this is where our loan systems, our grant systems should be kicking in to support those who really need that, so that there can be a repayment system after we leave school. Unfortunately, many of us who benefited from these loan schemes have not redeemed ourselves. At least I remember those of us who went to university in the 80s. I mean, even when we finished and we wanted to pay, there was no system to collect the loans that we collected back. So many of my contemporaries, I can assure you, were not able to pay, not because they didn't want to pay, but because the system was not there. Now the system has improved, and therefore we should all ensure that we pay the loans that we take, and so that others can also benefit from that. But
absolutely,
education and tertiary education, for that matter, is very expensive.
I know I said finally, but what happens to the next academic calendar? If somebody is looking forward to going to the university this year, what's the way forward?
Again, this is something that we've been discussing. From the look of things, definitely academic year cannot start in August. So we have to look and see how the pandemic pans out. Because let's remember that this is not the first time. We've had instances where the academic calendar had to be moved forward because of some circumstances. So my prediction, and again, it's just a prediction,
okay,
depending on how things pan out, the most probable thing is that instead of August, probably in October or maybe even in January, if the pandemic goes down. And if we have to wait till January to start the academic year, then it means that we need to either reschedule the academic year to begin in January or work out a crash program to be able to end the academic year in July again. But for now, everything is just people's speculations, and we don't know how the epidemic is going to end.
Absolutely.
And, as we all know, it has to be health first. So.
Yeah. Well, Prof, for those of us who love Christmas, we're just praying and hoping that it doesn't take us to Christmas. But thank you for your time this morning.
Thank you. Yeah, thank you so much.
All right, Professor John Japon there. He's a Vice Chancellor of the University of Health Allied Sciences, joining us from his base in HOH. We should visit him one of these days. Well, up next, Roland Walker is a conversation with the Member of Parliament for Ewutu Senya West, Mr. George Anda. It's ahead of the primaries this weekend, the MPP primaries. Stay with us. Roland Walker has that conversation.